Inspire, motivate, challenge.
Welcome, Bunmi.
Thank you, Maya.
Pharmacist Bunmi Olugbeja.
Olugbeja. Defender of the universe.
Defender of the universe.
Voltron like.
Alright, thank you for doing this.
Thank you.
So the name of the channel is Healthcare Soldiers. And the whole idea is to inspire, motivate, and challenge young professionals in the Nigerian healthcare industries. So I'll just start the interview. So my first question is, can you just tell us briefly about yourself, like your career in general, especially in the pharmaceutical industry, and how you started your chain pharmacy?
Okay, Mara. It will be difficult to talk about my career without talking about a little intro about myself.
Yeah.
I was born into a parent of business owners. My parents still are business owners. Of course, not at that scale anymore. They are tired, understandably. My dad is a businessman, done all sorts of multiple trades. There's a joke in my house about how when they first got married, my mom wanted to be a teacher. And when she told my dad said, no. So apologies, this is not about people whose parents are teachers, but my dad just thought, do business instead. So that, my dad business, my mom business, and so that formed the first basis of my adventures or my exposure to business, because that meant that the way my house is run, every holiday you are there, and then that break you usually would have in secondary school between when you'd finish your WAEC, right, do a jam, and then you're waiting for admission, even if it's no matter the number of months. You're usually supposed to be in my mom's shop and you're a sales manager, so you'll be involved with all of the business at that level. So that was my first exposure to business. Yeah, so fast forward, pharmacy school, after pharmacy, a bit of business in between pharmacy school here and there. But then after pharmacy school, after NYC, I wanted to be a rep. So I knew that I wanted to be a rep because I used to like to talk. I guess I still do. So I wanted a profession. I wanted to be global, so to speak. I wanted a work experience that would expose me to multi and diverse people and persons and global practice and all of that. So I knew what I wanted. I knew I wanted to be a rep, and I wanted a multinational. When immediately I finished, I was privileged. I served in Jos. I met some very good people who are still family till date, and one of them had, he was going to get another, so Emzor was starting an offshoot called Zolon, and so they were moving, it was something an offshoot called Hair School, they are medical surgical equipment, so they were moving him to that division, and his role was going to be automatically available. So he talked to me about it, and it seemed good. It seemed like a good idea. So I was finishing NYC, and then I already had a job offer. So I jumped at it, and I loved the city of Jos. It was so different from Lagos. So I stayed behind. So just came to Lagos for an interview, went back and started there. But then along the line, I wanted to do a master's, and for a few other reasons, I knew I wanted to come back to Lagos. And there was going to be an offer with a multinational. I remember I said I wanted a global experience. So I knew it was a move I was going to do. So I started out my repping experience in Jos from April 2008 to late 2009 when I joined Astra-Zeneca. And I was with Astra-Zeneca for till 2014. So that's like 5 years. I was there for like 5 years, and I had, so to cut it short, I'll just say here I am, because I then eventually resigned to start the business fully. So yes, that would do for the intro. And,
all right, thanks for me. So from 2009 to 2014, you were working for a multinational.
Yes, as a medical rep. That's what I was.
You resigned and started your own retail pharmacy business. So like what inspired you to do that? Why didn't you decide to follow the traditional career path in a multinational, hierarchy, as opposed to starting your own business? What inspired you?
To be honest, I didn't leave the multinational because I wanted to. I usually would say to friends that God closed all the doors and left only one open, and that was the exit door. I honestly didn't want to resign. I wanted to follow that path of progressing in my career, but things were not meant to be. Looking at it with the benefit of hindsight, I think it was honestly divinely orchestrated. I had some internal challenges with my uplines. The system was not conducive for growth. There were supposed to be a few interviews and all of that. Things didn't work out. But I honestly had started the business as a side hustle. Yes, I'd started the business. I started out of a need. I grew up in Ajegunle. Actually, my parents live in Ajegunle, and that's where I grew up. That's pretty much my early starting. And I remember I'd done internship, no, not internship now. I'd done my IT in JK Pharmacy, and that was the standard. And interestingly, my father didn't trust any of the pharmacies or the chemists. Even though I later found out there were a few pharmacies, they didn't trust the pharmacies and the chemists in the area. In fact, growing up, if anybody is sick, even if it's a headache, if it's so big that my father, we can't help you, we're going to the hospital. So we didn't understand how that, we didn't see those people as stopgap people that we could trust. So my dad actually used to go all the way, if we ever had to buy medications, to go to JK to buy medications. So I grew up wanting to, and when I started pharmacy school, I grew up wanting to set a standard retail pharmacy in the Ajegunle area. So I started the pharmacy as a side business. I figured maybe that was one of the reasons why I had the organizational challenges as well, especially when shortly after that, the multinational Astra-Zeneca had asked that we do a conflict of interest form. I remember that the training where they spoke about the conflict of interest, me running a retail pharmacy was clearly indicated as a conflict of interest. So I knew I had to resign. And from that day on, I think I did spend 6 more months. So the conflict of interest, for me, my conscience is very important, and being on the right side of the law. So that, coupled with the fact that I'd mentioned earlier that I was having a bit of dissatisfaction in the organization, then I was beginning to also get tired. You know, if you've ever done a repping job, there's a place where you get to and everything begins to plateau. You have the relationships, everything is going. The others are fine. No, you are still doing well. You are getting the job done, but it's not. So I wanted more, and the more would have been maybe a promotion and all of that. But that wasn't seeming to happen at the organization because of a lot of factors. So the next best door was to exit and face the business. It didn't seem like what I wanted, but I was glad for me because it was good. It was supposed to have been a stopgap, interestingly, but then it turned out to be all that I do, and I'm grateful that I do now. So.
Okay, so that's very interesting. Thanks, Bunmi, for sharing. So I just have a follow-up question on that. So assuming everything was fine in the office, at the company front, and you already started your business on the side as a side hustle, but if everything was fine, what do you think would have happened to your business in the long run?
I'll be honest and say there probably would be no Primeah Pharmacy at that level. It probably would have remained a side business. So you see, that's why I said with the benefit of hindsight, everything was divinely orchestrated. I believe in God and how that He works things out. So I honestly, I would have been comfortable. I'd have just sat pretty, and I'd have been rising in my career. I've always been a diligent person to give my work. At least that's the work ethic I grew up with. Interestingly, you know, when I mentioned work ethic, I remember that when I'd started the business as a side hustle and I was also a rep, my dad, because of course I was living at home at the time, I'm married, my dad would insist that I must give my employers their due. So I would not be found in the pharmacy. Not because my employer would catch me, no, but because my parents insisted that was wrong work ethics. So I'd be between the hours of 8 and 4. I would not be found anywhere else except on the field or with customers. Of course, sometimes it will take longer than that if you have meetings with doctors, if you're waiting to see them, all those roundtable meetings and all of that. But I typically was not I would never be found in the pharmacy at that time. So even though, because most times the conflict of interest thing is about how that it will take your time, or maybe you supplied or something. That was not it for me. My work ethic was strong, and I would not be in the pharmacy at any other time. So the plan always was to give my work, because my employers, like my dad would say, they are paying your bills, so sit here. I would spend that in the morning, and then I would spend my evenings, typically because of traffic and all of that. I would spend my evenings at the pharmacy. That was what I was doing. So truth is, maybe the business would not be where it is today, if everything had gone on well. So you see, there's always a reason to be grateful. Sometimes you never know what the big boss, what God is working around behind the scenes. So
yeah. So another follow-up question. I presume business was, at least fairly good at the time while you were still working. So, but since you're not able to be there, throughout the day, how did you manage that? Who was managing it for you while you were not there?
Okay, so for me, I'd always remember I told you that from the word go, I had told myself the plan was to start a standard retail pharmacy. So from the word go, I had taken the difficult route of employing pharmacists. So I always had a pharmacist there in the morning. Of course, I probably be able to pay. There was a pharmacist that I could pay for. So I typically would use maybe people in between, maybe people who either a copper who had an arrangement in his place of primary assignments, maybe people fresh from school. Those are the kind of people I had. But I typically actually had 2 pharmacists. So I was just a supporting pharmacist in the evening, especially because, remember I said I wanted to give my employers my all. And so I didn't want one pharmacy closing at 4 o'clock and then there's a stopgap, there's no pharmacist. That was not what I wanted. So there was always a pharmacist. So I'd started from the word go having a standard. I wanted a pharmacy that was running right. And of course, looking at all of it now, I think those are one of the things, at least for that store, that helped to endear me to the hearts of people. So how I worked around that was having people. And of course, with my extra hours, I'll then put in the rest. Maybe if I then finish from work, I'll then maybe go to a wholesaler's, buy, and all of those multi things that you do as the business owner. But I started out running it as a standard, and that was working. Remember I told you that in the area, to be honest with my colleagues, who were running pharmacies in the area at that time, the financial capacity of people wasn't a lot. So they had struggles. A lot of times they would leave their store, go procure, go do all of that. But I had thought to do that differently. And that actually obviously paid out, because when people know that they would find a pharmacist, we're also blessed. The location was also close to a hospital. So people are leaving the hospital with a prescription. They're coming, the pharmacist is explaining how to use the medications. They know that they're seeing a professional. So that of course worked in our favor, and the rest, like they say, history.
All right, fantastic.